Hey everyone, it's Dr. K. I just thought I'd go over a few of the most common voodoo treatments out there and give a quick breakdown on how and why they're not worth your time, money, or investment. Passive therapies like ice, electronic muscle stimulation, TENS units, mechanical traction, ultrasound, spinal decompression, and laser therapy are all generally not recommended by evidence-based guidelines. Passive interventions, they lack evidence of any long-term effectiveness, and the unquestioned use of passive treatment can actually delay your healing, especially when they're begun after recovery has already started. So passive modalities have not been associated with improved outcomes and recovery for patients. So let's talk about stretching, for instance. When most people think of stretching, they're talking about or thinking about static stretching, which is basically elongating a muscle to its end range and holding for a time. Now, there's no evidence to suggest it actually prevents injury or improves performance in the gym or on the field, or is a necessary component of a rehab program. So if you have a stretching program that you like, go for it. The reality though is any static stretching usually only gives temporary benefits, and more often than not, people don't even hold a static stretch for the amount of time necessary to induce the change in the tissues they think they're trying to induce. Also, I've seen a lot of crap clinics out there who recommend stretching even with pain, and that's just false. If it hurts to stretch, you don't actually have to stretch it. If we talk about ice for a second, ice has long been used to reduce swelling after an injury, and the idea is it constricts blood vessels in the area, which prevents blood and inflammatory cells from reaching damaged tissue. But if you think to yourself for a second, wouldn't blood and inflammatory cells be a necessary part of the normal healing process? You'd be correct. And if you're restricting them with a cold pack or an ice bath, aren't you just actually delaying or preventing good recovery timetables? Ice is really only gonna help mildly reduce your pain overall. It's not a permanent solution and should be weaned off as soon as possible. More importantly, if you're investing your, time going to a clinic and they're putting an ice pack on your back, I would make sure I ask them two questions. A, how much are you charging me and my insurance company for that service? And B, why are you doing something to me that I could just as easily do for myself at home? If I'm gonna invest my time, money, and energy going to someplace to get better, to heal, to get back to the things I love, I want to do something that's outside the scope of my own understanding and something that I can't do myself. That's why I'm investing in that expertise. Here's a hint. If they're doing that stuff for you, they may not be the experts that you think they are. Now, spinal decompression, this one has been considered by health insurance carriers as having no scientific evidence to support conservative therapy. I get it. People are suffering and they're desperate to relieve chronic neck and back pain. So they end up coming across this modality on the internet or some, other chiropractor's website, and it's the end-all be-all cure for chronic back pain. The idea behind it is these mechanical tables somehow stretch the discs of the vertebra and they allow the bulges and herniations to be pulled back in place, taking pressure off the nerve roots. I would be really worried and skeptical about how truthful those claims for success are, because these clinics, they typically have patients paying thousands and thousands of dollars out of pocket for something that's never been scientifically proven to live up to the hype. That's why insurance companies won't pay for the cost of the treatment, because there's no proof it works. It's been found to be experimental and investigational, and there's no adequate scientific evidence that proves it's effective for back pain. Now, ultrasound, that started in the 50s to treat everything under the sun, using sound waves to speed up the healing process. And in the 90s, research started to catch up to it and showed it had little benefit at all. So it began to fall out of favor with most practitioners. That's a good thing. They got more information, realized it was a garbage intervention, and started using more meaningful interventions. But there are still clinics out there that use ultrasound even though there's little, if any, evidence it does anything at all. People are going in and they're being charged for something, for a technique that's not effective. Now, laser, This one supposedly works with lasers traveling through the skin and increasing the way that the cells produce power inside the cell. And that's supposed to help accelerate recovery. But most recent and definitive studies on the technique showed that there's no benefit over placebo. One study even went so far as to say, clinicians should switch to known effective therapies and stop wasting finite resources and patient time. Now, electrotherapy, the electric stim can be used in a lot of different ways, but the traditional approach that I've seen it used in clinic is for symptom relief because it excites the sensory nerves to reduce how we perceive pain. But a meta-analysis basically compared its effectiveness and revealed it didn't improve symptoms of any lower back pain. This one actually doesn't do much, if anything, to actually heal injured tissues. And, if you just concentrate, less on the pain, but you're not moving around, you're not actually working towards your goal. Now, rest, sometimes under the right circumstances, active rest or bed rest are necessarily, but a realistic approach for improved outcome is active care. Rest can lead up to 10% loss of muscle strength, and it leads to unhealthy beliefs about your own work capacity. So if you think about even the loss of muscle strength, it takes you longer to, condition than it does to decondition. You have to overcome the degree of loss of muscle tension and fatigue and muscle size. So patients should be encouraged to return to active care component as soon as possible. I cannot stress this enough. Active care has been shown to provide better clinical outcomes for patients while also reducing associated costs for treatment. That's why it's such a big part of our care plan approach over at Rebel Mobility and Fitness. So I hope this has been informative for you. I would tell you not all clinics are built the same, and when compared, head to head, active exercise-based therapies are both less expensive and more effective than passive ones, even in cases where surgery is considered. Exercise can facilitate recovery and protect people long-term from their current injuries, make them harder to break. These aren't, they're not fancy. It requires a lot of work on your part as a patient, but at the end of the day, it does work. It's effective. If you have any questions about this, want to see what we can do for you, by all means, reach out to us. Let us know how we can help you. You don't have to suffer needlessly with pain, and you can return to activities you love doing with your friends and family. Just ignore all the voodoo treatments out there, and that'll be a good start. I'm really celebrating your success already. Stay strong, inspire others.